Welcome to Healthcare on My Mind. I'm Kanetta Atkins, Senior Coalitions Manager with Georgians for Healthy Future. And with me today,
My name is Shathia Jackson.
My name is Paul Michael. I'm from Stockbridge, Georgia.
I'm Ridhya Shah Daya. I am a medical student at Medical College of Georgia.
So my name is Toby Terwilliger. I am a hospitalist here in Atlanta, Georgia.
I heard about it signing up through the SNAP program, my food stamps, and I went ahead and clicked on, sign up for Medicaid too. And they said I was eligible for the pathways.
how is it meeting your healthcare needs?
I can make appointments, and they tend to be, fairly timely about getting me in there. I only had one issue, and that was when they charged me for something that I didn't know what it was for exactly. And it was totally unexpected to me because I didn't have the extra $50 to pay for a fee that when I hadn't even been there before. So
I'm not gonna lie, where we live, the amount of doctors versus the people ratio is huge. We're traveling at least 2 hours or more to get the specialist because it's so limited here. The medicines needing the pre-authorizations, not getting it in time, that's ridiculous, and that's what we've been dealing with. Just yesterday, my son, he received his new wheelchair stroller, and I've been so excited about that. But he received his new wheelchair, but that chair is $17,000, and there's no way that I would have been able to, get it.
Paul, I saw you shaking your head when Shathia mentioned the ratio of people to providers.
I lived in a small town from 2000 to 2015. I lived in South Georgia, where Georgia and Florida, Alabama all meet at, and it's like, if you need any kind of specialist or anything special, you got to drive 45 minutes, either north, south, or east or west.
Yeah, my son's specialists, they start about 30 minutes away, and as I stated before, the ones that he goes to see on a regular, at least 2 hours away.
If everything goes as it's supposed to, it takes an hour or so. If everything's perfect, on my end is not the problem. It's just actually getting it in the system. That's when the nightmare comes on. It may be, you never know. It might be right at sign on, just trying to sign in. It might not recognize your password, or I was dealing with an expired password last time. So I needed to update my password or whatever. My password had expired, and I needed to reset it or what have you. And that took, it was during the week, and it took into the next week before I actually got taken care of, before I actually spoke to somebody, and she actually sent me a link that I could, it was a temporary password, and I had to go through all that, it turned into days, literally. I can assure you that it's not just me. It's got to be something with the system.
Yeah, thank you for painting that picture of just how much time it takes for you to go through that process.
It seems like they update that website more than anything. And and then you end up getting locked out, and then they're telling you, hey, you have to go through all these different steps and stuff. It's a lot. So if you, like he said, if you're not tech savvy or even a little bit, you may very well give up. And the fact there are no offices around for you to go in and see or speak to anyone, and then you get on the phone and you go through the automated system, and then they take you through another automated system.
If you could talk to a lawmaker in Georgia, imagine that they are in the room with you, what would you say to them?
Take yourself from the place that you are, the comfortability of your life, take it and just for once look and see and realize people are needing of these things. It's not like we're just asking because we want it. These are things that we actually need. We need healthcare access. We need access to better doctors. We need access to better just options. We don't need to go through all of these pre-authorizations to get things that we need, because if If we didn't need it, why would the doctor even need us to have it to be authorized in the first place? It's more than enough funding, and we need people who are at a higher level than us just citizens to realize that and to go about helping us the best way that they possibly can.
I think that they should make the navigating the system easier. You should be able to maybe call somebody up and have them do it like an online interview. They just ask you questions and they put the information in for you.
We really just need to make sure that the people who need to be able to access healthcare are able to do so, and are able to do so because they have coverage that is going to allow them to go to the doctors or hospitals that they need, and also are able to do so because the act of going to the doctor is not going to lead to financial ruin or financial hardship.
A lot of what I'm learning right now and what I keep continuing to learn is that there's a lot that I will be able to do for my patients in the future, and there's a lot that wonderful physicians like Toby are doing for their patients now. A lot of times physicians and community health providers and other providers and public health officials are kind of limited by policy and also by some of the barriers that they themselves face in being able to provide care. And so something lawmakers can do is reduce barriers to access and kind of support safety net hospitals and support community health providers more to be able to use all of these tools and all of these wonderful officials and workers to be able to provide all the care that Georgians need.
Put yourself in our shoes. Push for the releasing of the funds that Georgia does have.